Klor-Con 8 is a mineral supplement that is used to treat or prevent low levels of potassium in the blood. Potassium is essential for the proper functioning of your cells, kidneys, heart, muscles, and nerves. Most people get enough potassium from their diet, but certain conditions like severe diarrhea, vomiting, hormone problems, or treatment with diuretics can lead to low potassium levels. It's important to take Klor-Con 8 as directed by your healthcare provider to maintain a healthy level of potassium in your body. The recommended daily dosage and the best time to take Klor-Con 8 will depend on your individual needs, so be sure to follow your healthcare provider's instructions. When taking Klor-Con 8, it's important to follow your doctor's instructions. Take each dose with a meal and a full glass of water to prevent stomach upset. It's best to not lie down for at least 10 minutes after taking this medication. Swallow the capsules or tablets whole, without crushing or chewing them. If you have trouble swallowing the capsules, talk to your doctor or pharmacist. Some brands may be opened and the contents sprinkled onto a spoonful of cool, soft food such as applesauce or pudding. Immediately swallow the food/medication mixture without chewing. Do not prepare the mixture ahead of time. Drink a glass of cool water after each dose to make sure you swallow all the medication. Take this medication regularly at the same times each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment. Do not increase your dose or take it more often than prescribed. Do not take more than 20 milliequivalents per dose. If your condition does not improve or if you have symptoms of low potassium in the blood, such as irregular heartbeat, muscle weakness, or cramps, be sure to tell your doctor. If you experience upset stomach, nausea, vomiting, gas, or diarrhea, let your doctor or pharmacist know. It's possible that you may notice an empty tablet or capsule shell in your stool, but this is harmless as the medication has already been absorbed by your body. Remember that your doctor has prescribed this medication because the benefits outweigh the potential side effects. However, if you experience difficulty swallowing or feel as if the tablet is stuck in your throat, contact your doctor immediately. Seek medical help right away if you notice symptoms such as vomit that looks like coffee grounds, severe stomach pain, or black/tarry stools. While rare, if you notice signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Klor-Con 8, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. You should also discuss your medical history with your doctor or pharmacist, especially if you have heart problems, kidney problems, or high levels of potassium in your blood. Due to rare reports of stomach/intestinal ulcers and bleeding with sustained-release potassium products, taking a liquid form of potassium is preferred. Let your doctor or pharmacist know if you have throat, stomach, or intestinal problems such as blockage, narrowing, or ulcers. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to consult your doctor or pharmacist before using other potassium supplements or salt substitutes that contain potassium, as taking too much potassium may cause serious side effects. If you are pregnant, Klor-Con 8 should only be used when clearly needed. Make sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using Klor-Con 8. It's important to be aware of potential interactions with other medications while taking Klor-Con 8. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Inform your doctor or pharmacist if you are regularly taking other medications that can also raise your potassium level, such as drospirenone, eplerenone, ACE inhibitors, angiotensin receptor blockers, potassium-sparing, water pills/diuretics, among others. Also, let your doctor or pharmacist know if you take medications that can slow down the movement of potassium in your stomach or intestines, which could potentially increase the risk of side effects, such as ulcers. These medications can include atropine, scopolamine, certain antihistamines, antispasmodic drugs, bladder control drugs, and certain drugs for Parkinson's disease, among others. Always consult with your healthcare provider before making any changes to your medication routine. If you suspect an overdose or experience serious symptoms such as passing out or difficulty breathing, seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms of overdose may include irregular heartbeat, muscle weakness, and confusion. Remember not to share Klor-Con 8 with others. It's important to have regular lab and medical tests done, such as checking your potassium levels and kidney function, while taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. It's also important to maintain a well-balanced diet. Foods that are high in potassium include bananas, oranges, cantaloupe, raisins, dates, prunes, avocados, apricots, beans, broccoli, spinach, potatoes, lentils, chicken, turkey, beef, and yogurt. If you're unsure about which foods are best for you, consult your doctor or a dietitian for recommended options. If you happen to forget to take a dose of Klor-Con 8, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing Klor-Con 8, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. And when it comes to getting rid of any unused or expired medication, it's crucial to do it properly. Instead of flushing it down the toilet or pouring it into a drain, it's best to consult your pharmacist or local waste disposal company for the safest way to discard it. This will help ensure the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.